Welcome back to Studio Chatter. We are talking with Megan Johnson, the nurse administrator at the new Spanish Fork Hospital. We are all so excited for this new facility. And we also want to know about the new clinic that's adjacent to the hospital.
Yeah, so we call it our MOB, the medical office building.
Okay.
There's 3 stories on the clinic side, attached right to the hospital. So easy access from the clinic right into the hospital. We've got 4 or 5 clinics that are set to open up with us. We've got sports medicine, orthopedic, family practice, and then the Springville Instacare will move on site with us April 5th. Yeah, so we're really excited about that. The Instacare is very excited, so the old WorkMed will move into the Springville Instacare current site, and the Instacare will move on site with us. So really when you talk about availability of resources, it's really top notch. It really, we both work off of each other. We really help each other to be successful. So if the hospital is needing services, we can provide to the clinic, and if the clinic is needing services from the hospital, really looking at optimizing patient care, patient satisfaction.
Totally, they can just hop from one facility to the next.
Or say, hey, we can't have you in Instacare, let's get you over to ER.
And really that's a process that we looked at. We really defined what that process is for patient safety. How do we get a patient from the Instacare over to the emergency department? You know, if a patient shows up randomly at the Instacare stroke or cardiac symptoms, how do we get them safely from one place to another?
Now they're just right next door.
Yep, and so that's a process that we've been working over for the last about 2 months, closely with the Instacare to make sure, because the Instacare's never had this resource before. They've always had to call 911 or transfer the patient by private vehicle.
I could just tell your excitement. It makes me excited for all of it.
I bet the other facilities around the valley and state are a little envious. Like when anything's new and you guys have the latest and greatest of everything.
Yes, able to plan off of seeing how other things have gone.
Yeah, so I mean, Stacey, you went through the VIP tours. We were able to tour with some of the other leaders from other hospitals, including Mountain View, and really I'm so excited for this collaboration with Mountain View.
That's so
cool. There's no competition. We really have the best interest of the community at heart, and I can tell you that is the same from the leadership there. We're going to work hard to make sure that this community is taken care of, that we have the resources that they need, and really make it a collaboration and work together.
I love it.
We're really excited about that.
Tell us a little bit about the CEO and his leadership.
So Francis Gibson is our CEO, our administrator. I worked with him previously at Orem Community Hospital, so he and I have an amazing relationship. We work very well together. He has a second job, I would say, part-time job is what he calls it. He is the majority lead for the House of Representatives, so really he's MIA for about the first 6 weeks of every year, and about 1 or 2 days a month.
So you take on 2 roles
with that position, but you know, he's always there. He's always available. He has the biggest heart, and the best sense of humor, and so I really love working with him. And really, when we set out on this venture together, I wouldn't have done it with anybody but him. And so it's been great. He really is the one that defined the culture and what we wanted to bring, and how we were going to set that expectation right up front.
He'll be great at that. And if I can add to that, Francis was instrumental in fast-tracking that new exit between Spanish Fork and Springville. 30 years ago, Smith Auto built their Smith Auto Care because there was going to be an on-off ramp right there. Never happened. They sell it to Tim Daly, and now the on-off ramp should be there in 2 years.
Yes.
So he sped that through, because of who he is and what he does, and then he was assigned the CEO of the hospital. Like, the stars aligned, and that's going to be so big to have that there.
I mean, if you look at the exit, the Main Street exit off of Highway 6, and the amount of traffic that is already there, it's going to be great to have that resource that exit right there. And I mean, he pushed it along. We were thinking it was going to be another 10 years before we would get that.
So great.
It'll be a good.
He'll be fantastic.
Yeah.
Well, I have to ask also about telemed.
Yes.
Tell us a little bit about that. I mean, I'm sure it's been kind of interesting building a hospital in the times that we're living in right now. So.
Yeah, you know what? And it's kind of ironic how it happened. With the pandemic, telemedicine has become so much more important.
Right.
We've used that resource so much more this last year. And just how it flows, how it's evolved, the timing is perfect. So when we started building Spanish Fork Hospital, we knew we wanted to bring telemedicine in. I don't think we totally understood the full capability. So telemedicine is where we have the ability to call in with monitors to a specialist, and that maybe they're not on site. So we've got telehealth in all of our emergency department rooms. We've got them in all 5 labor and delivery rooms, and we've got them in all 16 of our med-surg rooms, which is huge. Huge for a new facility.
So it's not just like calling the doctor to talk about a symptom. The doctors are actually using it to facilitate.
Yeah, so we've set this up for the doctors up at our hub of telehealth to be able to help us run codes, to help us to provide extra support to our neonates, our newborns that maybe aren't transitioning after labor, after delivery, as they should. And so, but it extends to that. We can provide crisis interventions for mental health. We can do wound care. We can do palliative services, interpretation services. So really infection prevention and services, we can do so much with this capability. And then we've also got 2 portable telehealth monitors. One will be located in our CT scanner, because if we have a patient that comes in with signs and symptoms of a stroke, our goal is to get them to CT and connected with a neurologist in under 10 minutes. And this allows us to get them to CT and connect them at the same time. So, time is brain. That is our goal, under 10 minutes, which seems crazy. And then we've got one in our postpartum area. So if a mom starts to hemorrhage, if there's difficulty after labor, we've got that connection right away, and there will not be any delays.
Okay, I want to go off the list for a minute. We have so many things, but two questions I've thought of. The ER.
Yes.
So, I mean, Spanish Fork, Highway 6, lots of accidents happen there. What percentage can go straight to your hospital, and what percentage do you think will have to go further and go to Utah Valley?
So really, anybody can come into the emergency department. They are trained to do anything and everything. They are certified in trauma nursing, pediatric trauma nursing. Our providers are the same providers the same provider group that's at Utah Valley Hospital. So they are trauma certified physicians, which is an amazing asset to Spanish Fork community. So they can take anything. If anything walks in the doors, private vehicle, they'll take it. Now, if our ambulances respond to a crash up in the canyon and Life Flight's called, Life Flight will not come to Spanish Fork Hospital. They'll go directly to Utah Valley Hospital, because it's a trauma too. There's more resources available. But we will have at Spanish Fork Hospital an on-call surgeon, orthopedic on-call, to be able to provide those services that we can close to home. Anybody needing a transport out because they require a higher level of care, we have those resources. We've been working on that. We've been working with Spanish Fork City EMS and Mapleton EMS. What does that look like? And really getting a process, collaborating with them. If we need to transfer somebody to Utah Valley, what does that look like to make sure that we're keeping our patients safe?
Okay, my other question, so technically, like 3 years ago at the groundbreaking, our goal, City IHC, was to have this facility open last fall.
Yes.
COVID hits last spring, everything was delayed. Do you feel like gaining this extra 6 months has been advantageous, or do you feel like, it's just dragging everything out, I wish we would have opened back then? Or do you feel like, well, we were really, truly able to accelerate or produced steps and procedures that have been helpful?
Can I say both?
Yeah, I want to hear what's.
It's been challenging. It really has. You know, we were set and ready to go October 26th to open our doors and be able to provide this resource to the community. You know, we wanted to take COVID patients. We wanted to be there and available to help offset some of the demands at the other facilities. It didn't happen, and it was hard. It was really hard for those of us that were already on the project. But when you look at where we're at today, I can't complain. We are ready. We were able to think through processes more, to come up with some ideas, and really, truly, it allowed some of those caregivers that were frontline to remain frontline, to help those when we were surging, when there was an influx of patients with COVID, when we were maxed out, when we were trying to figure out, you know, how are we going to move this ICU patient and this med-surg patient, who's being discharged, when are they being discharged, because we need more rooms. You know, we really were able to leave a lot of those caregivers frontline longer than anticipated, which was a great asset to Utah Valley, to Orem Community, to American Fork, to, you know, Sanpete, Fillmore, Sevier, those other hospitals. So really, it was bittersweet.
I bet it was hard to say, oh, we'll wait 6 more months.
Yes.
Well, now we're finally here, and it's nearly opening day. What makes that so great for you?
You know,
last and final.
Really, it's like I talked about. It's the culture that we've built, and what that means to the community. I hope that when they walk through those doors, they feel that it's different, that each and every caregiver truly wants what's best for them. They want them to get the services that they needed. How do we get them back to optimal health? How do we get them back to the community? Really, that's our whole goal. Healthcare is changing more and more to less inpatient and more treating patients at home. They do better. They're more comfortable in those situations, and so. You know, we're really excited about that. And when you look at access to care, preventative measures, and the ability to provide that to Spanish Fork community, and just South County really is what I'm most excited for.
Great.
We are
Thanks,
super
Megan.
lucky.
I can already feel that a bit.
Yeah.
Thanks so much.
Thank you.
Thank you.
There's more Studio Chatter coming up.